All right, just going to give a few seconds for people to get their audio connected, and then we'll jump in. And I imagine that more folks will be joining the next couple of minutes. Okay, good afternoon, everyone. Thank you all so much for being here. I'm Rachel Newman Green. I am the Program Director for Food Access and Nutrition Security with the Rhode Island Food Policy Council. And I'm really glad to be able to invite you all to the first quarterly meeting for 2024 of the Rhode Island Hunger Elimination Task Force. I will invite you all to introduce yourselves by putting your name and affiliation and maybe something brief about what brings you here today into the chat if you'd like. That would be great. It's so nice to see so many faces. Um, and So just to remind you what brings us here today, the Hunger Elimination Task Force's goal is to come together to reduce hunger and increase access to healthy, culturally appropriate food for all Rhode Island residents. So it's a great place for folks to join. I think we always have a really wonderful representation of interests and faces and voices from that throughout the state, and always some really useful information gets shared. So thank you all for being here again. Today, we're starting off the first quarter by focusing on the issue of food delivery and emergency food delivery. This is a topic that has come up certainly, as we know, starting with the COVID pandemic, but I think has repeatedly come up in our conversations with you all and other community members as pressing need for discussion and improvement throughout the state. So we have a really great panel today of folks who are going to be talking about opportunities to fund and sustain food delivery throughout the state. So I think that that'll be a really interesting opportunity to hear from folks who have different experiences with that, and also to have a question and answer at the end with those panelists about their work and about their vision going forward. The other thing we're going to get to at the end of this agenda today is a new structure that we are going to start to use in the HETF, which is action groups. And I'll talk about that a little bit more in the end, but specifically at the end of the meeting today, we're going to be asking folks who are interested in joining an action group and having a few focused meetings to develop recommendations specifically about what we can be doing here in the state to improve food delivery. I'll get into details and more about that later. And then we're going to close today with announcements. And we have a few things, a few updates that we'd like to share with people about various planning processes and other things going on in the state. And there'll also be an opportunity then at the end for any of you who would like to be sharing your announcements to do so with the rest of the group. So again, great to see you all. Welcome. Happy 2024. It's great to be with you. And I'm going to pass this over to my colleague, Max, to start the presentation about food delivery.
Thanks, Rachel. Hi, everyone. So to begin our conversation today, we wanted to prime our conversation with a little bit of background research around the need for food delivery and funding for food delivery. So we can all be on the same page as we dive into our panel later today. So to begin, we wanted to just talk a little bit briefly about the need for food delivery. And I'm sure in a lot of ways, this sounds a lot like an echo chamber. We all know the importance of food delivery here for our transit challenged and homebound Rhode Island residents. So the first thing we wanted to share is that last September, the Urban Institute conducted an extensive research study with DoorDash, Project Dash, on connecting people with charitable food through home delivery models. And so they explored the impacts of this research. And in their study, they found that 97.8% of clients reported saving money from being able to access home delivery. 78.4% of clients received this charity food, receiving the charity food had chronic health conditions and or mobility challenges. So we can see that the majority of folks who are taking advantage of these services are folks who otherwise would struggle to gain access to this food. It also found that only 44% of the clients who were being served in this program had ever been able to receive charity food before. So 44% of the people who were participating could otherwise not access this food. And finally, 88% of clients found that because of the option for food delivery, time savings allowed them to improve their health. So 88% of them found that their time savings enabled them to improve their health and take care of their health in ways that were meaningful for them. And so we know there's a need for food delivery, but we also know there's a lot of challenges around funding food delivery. And so funding is the most cited barrier in that Urban Institute study. They also found funding to be the most cited barrier to maintaining and expanding home delivery options. As many of us know, the end of pandemic era funding is causing organizations to lose access to funds that really allowed them to expand their capacity. We know that food delivery can sometimes be not a desirable funding request on its own. I'm sure many of you have encountered that in filling out grant applications, that on its own, many organizations don't want to just fund food delivery, which is a big challenge for engaging and expanding this capacity. And finally, we all know grant funding is not sustainable. The research by the Urban Institute found that all of the anti-hunger organizations that are providing food delivery, at least in this study, were looking to pivot towards more sustainable funding models that allowed them to braid revenue streams to offer this delivery. And so finally, what do we expect for food delivery in the years ahead? How can we think about what funding might look like for food delivery? So what that report from the Urban Institute found is just one example of what food delivery will look like in the years ahead. Many of the organizations that they interviewed reported the community need for delivery is outpacing organizational capacity. More people are looking for food delivery than is possible to give. The majority of those organizations also reported that they plan to continue offering home delivery with the goal of expanding despite the end of these COVID era funding opportunities. And finally, sustainable funding would enable these organizations to strategically integrate home delivery into their other services and broader mission. So quite a few organizations pivoted during the pandemic to be able to offer home delivery, and now want to be able to integrate that more into their broader services and mission. And so having an opportunity to access more sustainable funding would allow them to do that. And so this was just a little bit of the research that we're seeing out there around the challenges and opportunities for food delivery that we wanted to ensure the group was able to understand and have as background before we dive into our panel. So with that, I will pass it over to Sarah, our new colleague at Rido.
Hi, everyone. So today's panel, as we discussed, is going to be focused on opportunities to fund and sustain food delivery here in Rhode Island. And we are very lucky to be joined by 3 Rhode Island experts providing food delivery to Rhode Islanders in need. First, we are joined by Meghan Grady, Executive Director at Meals on Wheels. Meals on Wheels of Rhode Island's Board of Directors named Meghan Grady Executive Director in June of 2019, chosen to lead the organization toward statewide growth through modernization and increased funding support. And while working to meet an increased need for home delivery meal program throughout the pandemic, Meghan has celebrated delivery of the organization's 20 millionth home delivered meal and established Meals on Wheels of Rhode Island work in the maternity and health equity space. Meghan is also an appointed member of the Governor's Commission on Aging and a member of Brown University School of Public Health's Community Advisory Board. Prior to joining Meals on Wheels of Rhode Island, Meghan was COO for 8 years at YWCA of Rhode Island. Next, we are also joined by Mariana Roa Oliva, and Mariana has been a part of CartWheel Rhode Island since 2020, taking on different roles within the organization. And Mariana currently acts as the coordinator of the food pantry delivery program. And finally, we are also joined by Jeanette Nessett. Jeanette Nessett is Community Outreach Specialist with Lifespan Community Health Institute. Jeanette is a registered and licensed dietitian and nutritionist and a member of the Academy of Nutrition and Dietetics. She graduated from Syracuse University with a Bachelor of Science degree in nutrition. Her nutrition expertise includes serving clientele of all ages and working with multicultural populations. She has experience in community nutrition, individual assessment, and counseling and group planning and education. She is involved in a variety of coalitions and networks on both local and national levels. Jeanette was with Lifespan's employee wellness program from 2006 through to 2019 when she transitioned to Lifespan Community Health Institute. And as a community outreach specialist, she currently provides programs for school-aged children and adults and collaborates with many community partners. So we are very fortunate to be joined by these 3 experts today. And so just jumping right in, just kind of to start off, if you could maybe tell us a little bit about how you're currently able to fund your food delivery operations, and maybe it would be a little bit helpful to kind of preface us with how your food delivery operations functions in addition to your funding streams.
Great. I can go first. Hey, everybody. I'm Meghan Grady, Executive Director at Meals on Wheels of Rhode Island. Thank you for the opportunity to be part of this panel today, and hello to my fellow panelists. People are most familiar with Meals on Wheels and its home-delivered meal program that serves homebound older adults. But under our 2025 strategic plan, we've taken a broader approach to food access and to food delivery. To speak to our home delivered meal program, it is funded through a variety of revenue streams: federal funds through the Title III-C Older Americans Act, state funds through an annual state designated grant, donor dollars and philanthropic support, and then healthcare partnerships. So that is primarily how we fund our work. When we think about our expanded approach to food delivery and to prepared meals, we are really looking closely at the opportunity to grow our existing healthcare relationships. So that's a little bit from me.
Thank you.
You go ahead.
Go ahead, Marianne. I guess I'll go next then. Lifespan Community Health Institute, we at Lifespan Community Health Institute, we have a produce prescription program, and we have depended on philanthropy to fund small grants from local foundations to fund our program, and they have allowed us to purchase produce and pay for delivery operations. Unfortunately, produce to nutrition and food insecure patients is not a reimbursable expense. And so therefore, it's very hard to find a continued reliable resource. We do provide, it's our 2nd year now, produce to about 75 patients and who are food insecure with regards to children and adults and those who have elevated A1C levels. So there's a clinical model involved in that. We were providing it, our produce was procured from Southside Community Land Trust during the growing season, and then through Amazon or Rhode Island Food, Farm Fresh Rhode Island, to extend our distribution season through the winter into the December. And we're hoping to grow our program as well. So that's where we are at this point.
And hi everyone. So CartWheel started out as a pay what you can model, with a pay what you can model, which means people were able to put in an order. The food, we get it from fresh produce from Farm Fresh Rhode Island as well. And so people can pay in. And you know, the idea was those who can pay more will be directly subsidizing the orders of those who can pay less. And you know, it's a very like small operation how it started. Later, we were able to create partnerships with some food pantries in Rhode Island, probably especially in the Providence area. And so now that food that comes from the food pantry, we've been subsidizing the deliveries through grant funding. So for instance, we had the ARPA grant, which was super helpful just during the pandemic. And we've also had the support of the CBS Hometown Fund more recently. And more recently, we've also started partnerships with Integra Community Care Network. This is a new model that we're trying out, and also a partnership with Southside Community Land Trust. So we're looking for new ways to sustain our work that are more reliable and more long-term, as Max commented at the beginning of the presentation, so that we don't have to be chasing the small grants that are also running out post the peak of the pandemic.
Yeah, okay, great. Thank you so much. So it sounds like, you know, we're hearing similar to how Max introduced this topic, like a variety of funding streams is important, but also looking to build existing partnerships with different community organizations to potentially seek more sustainable funding opportunities. So moving on to challenges now, what do you think are the greatest challenges in securing enough funding to maintain or expand your operations?
Well, I think that, you know, we kind of touched on that a little bit in this first question, in that we need more funding, we need sustainable funding. But I think what I'll call out is also that food is expensive. You know, whether it's our prepared meal product or our supplemental grocery delivery, you know, the same challenges that we're all seeing doing our own grocery shopping, think about those challenges times, you know, we project this year that we'll do over 350,000 meals, right? So I think recognizing that food is expensive and that the cost of food goes up every year almost creates the perfect storm: limited resources, lack of sustainable resources, and a very cost-reliant product.
And I think in addition to that, in our case, as we were relying on philanthropy, it means that we have to constantly search for and apply for grants. Most grants are a year duration. We don't have a dedicated grant writer, so we need, you know, somebody who can devote their time to that. And by the same token, we would like to not only maintain our VeggieRx program, but to expand to serve more patients. But it's also unwise or not fair to patients to do so without assurance of multi-year funding. So that puts an extra burden on it as well.
Mm-hmm.
Yes, absolutely. Everything Janet said. And I think I feel like there's something fundamentally flawed about applying for grants, because I know that when I'm working on a grant for CartWheel, I'm competing with other people who should also get the funding. So there's something there that makes me feel very conflicted. But beyond, you know, that fundamental flaw that I don't know what we could do about, there is, I forgot to mention that the fresh produce that we distribute from Farm Fresh, we have the capability of accepting SNAP from clients, and when people pay with SNAP, they get bonus box. So that's something that goes a long way into, reducing how much somebody has to pay for a home delivery. But prices are still very high, as Megan was saying. So, we don't set the prices. And I think maybe there's something about the way that we partner with other organizations, perhaps because it is kind of unique. Like, we are focused on the last mile of food distribution, and this is not always very clear to clients. So it's difficult to say, like, these prices, we didn't set them. These are the prices from Farm Fresh. And similarly with food pantry food, it's difficult because the quality of the products that we're able to deliver is not always great. There's a lot of hurdles in the bureaucracy of like getting somebody registered for a food pantry, especially if they're homebound and they can go to the pantry themselves. And so communicating this to clients and saying, like, we don't actually have the food. Like, we are a very, very small organization. We have to split ourselves between delivery and then applying for grants and then reporting for those grants. And there's just a lot of work that's made more complicated by the lack of sustainable funding and being always on edge. Like, are we going to have funding next year? We don't know.
Mariana, I like what you said in that, funders will often promote collaboration across partners and then put us in an environment where we compete for limited funding. So that was pretty insightful. Thank you for that.
Yeah, thank you so much. You are all raising excellent points around funding sustainability and working in a competitive environment when, organizations have similar missions. So thank you. So kind of thinking along that line, I guess, what are some innovative ways other organizations can look to maintain and expand fiscal support for their food delivery projects, especially thinking along, discussions of beneficial partnerships, like you've already mentioned, with other nonprofits. So innovative ways that other organizations can look to maintain and expand fiscal support for their own food delivery projects.
Well, we've talked a little bit about in different circles about the idea of engaging in bulk purchasing of produce and contracting with a delivery program to, as a group to achieve lower pricing. Maybe also co-funding the administration of a produce delivery program, co-funding staff or vendor contracts, but maybe working more collectively to bring prices down and to make it work a little more smoothly might be an option.
I think advocacy is a big piece of it. Policy change can be the sustainable pathway forward.
Right.
So, I think that really, I had the opportunity to attend a advocacy day for the Rhode Island Community Food Bank. I think it was last Tuesday at the State House. And as much as we can identify best practices or policy solutions, I think that that's where we're going to get that sustainable environmental change.
Right. Yeah, absolutely. Thank you.
Yes, I think that's so right. Policy change, and also some things that are related to food delivery that, I'm thinking transportation. So a lot of people are homebound partly because of the infrastructure of the state, and that will go a long way. If there's better public transportation, some people will be able to go to a food pantry themselves, and also, get the advantages of being able to be outside. But I think a challenge that we experience with CartWheel a lot is because we're so small, it's very hard to give everybody a specific time that will deliver the food, and sometimes this just adds complications to the logistics. That the burden of logistics falls on small organizations like us instead of it being solved kind of like a more statewide level. But definitely in terms of innovation, I want to echo also what Jeanette said. Buying in bulk is really important, it's really helpful, and it's difficult to do, to work these economies of scale if we are working separately. So figuring out more ways to work together. And specifically at CartWheel, we've been working with technological innovations to make deliveries smooth, kind of to reduce the amount of work that we have to do to deliver the food. So setting up event is our other co-director who's been doing a lot of great work, programming, mapping capabilities, and automatic text messaging and stuff like that that can help us with the work, the logistics of this work.
Yeah, thank you. So I guess kind of continuing on this line, what role do you see for state agencies to support your work? I mean, I know, Megan, you discussed the importance of legislative and policy changes, but if you want to elaborate on that or talk about additional roles that you see for government agencies in this work.
Well, I think that, COVID really changed the environment in a lot of ways.
Yeah.
I think that, like, if I think back to what Meals on Wheels advocacy looked like in 2019, it was very different than what
Right.
it looked like in 2024. So I think as an organization, given the change in our strategic direction, we very much see ourselves in a time of capacity building where we're just trying to educate stakeholders about our programming, about our vision and about our value add as a community player. So, we aspire to have a robust advocacy agenda. I think what we're currently focused on is building deeper relationships with stakeholders and decision makers.
I agree with that. And we all know that food, nutrition, and security are essential for, health and well-being. And it just seems ludicrous that we're talking about trying to feed people when, it should be there.
Right.
However, with a government approach, maybe naming food and nutrition security as a priority, because sometimes it seems to get wrapped up in the whole budget issue and then it, falls off the ledge. Maybe using government programs like SNAP, WIC, foster families, cash food assistance, et cetera, to identify residents who could benefit from assistance, maybe invest more in our local farmers, subsidizing the purchase and delivery of produce, and maybe even investing in infrastructure to facilitate more year-round access to produce, et cetera. I think, especially in our part of the world, access in the winter months, for example, becomes more of a challenge.
Yeah, thank you.
I know we're holding questions to the end, but I just wanted to call out there is some great chat going on in the chat box. Someone calling out, there is innovative work being done here in Rhode Island, and that is very promising. So I want to make sure that we recognize that. And then also someone calling out sugar sweetened beverage tax as a potential revenue source. Again, like I think that as much as there are many challenges in the environment, we can definitely pinpoint solutions and pathways forward.
Yes, that is a great idea. I'm originally from Mexico, and that we've seen the effects of the tax on sugary drinks. It does reduce the amount of consumption, and it also provides a source of funding for these kind of initiatives. And I wanted to say also, maybe the way that we talk about the need for food delivery, it's great that the pandemic has allowed us to highlight the importance of that. But maybe it's good to kind of reframe the conversation so that it is not, because if we continue talking about it in terms of policy as like something that's related to the pandemic, we ignore the fact that it has been a long-standing issue and that there's organizations like Meals on Wheels that have been working on this for a long time and that identify the vulnerable populations that have required this type of assistance for much longer than the pandemic. So framing policy in that way, so that we can also, just not get kind of like a lump sum fee, but more sustained support for pantries as well.
Yeah, thank you so much for your comments. And so our last question, or from us, asks how can state agencies actually ensure that funding meets the needs of your organization to provide this delivery or these delivery services. And then also I'd be interested in hearing about how you would like to see kind of food delivery evolve in the future. You know, your hopes for how food delivery will change going forward.
I think our vision is anyone who needs food delivered to their home receives food delivered to their home, right? Like I think that that's sort of like, you know, it's an access, it's a nutrition, it's a human rights issue, right? So I think like, you know, in the big picture, that's definitely what we're all working towards. So I think then to backtrack to the first part of the question, I mean, I think at Meals on Wheels, we feel very supported by our state partners. We have terrific relationships, you know, across state government. And I think that, you know, there's going to be like a shift in the environment with the pandemic funds expiring. I made a note here, you know, organizations are losing funds that allowed them to increase capacity. That is absolutely what is on our minds every day at Meals on Wheels as our ARPA funding is running out. You know, that's not a state issue. That's very much a federal issue. And so I think that like I hope for, you know, historic investments at the federal level. I think that it's kind of like we look to the state, but the state's actually looking to the federal government. And so, you know, that I think just really good coordination. You know, our annual public awareness campaign is coming up. It's called March for Meals, where we educate our members of our federal congressional delegation and our state decision makers and anyone who wants to be part of it about the benefits of Meals on Wheels. And this year, our messaging will be a little bit broader to include, you know, the details around our strategic direction and our broader approach to food access. So yeah, I mean, we'll kind of continue doing the good work, and I know that, you know, everything will work out the way that it's supposed to.
We have an advantage in that we are a small state. I've lived in some very big states where the North didn't know what the South was doing. You know, we don't have that problem. So I think the more we can look at things collaboratively, to your point, Meg, that, you know, we support each other, because being small and competing against each other is just, you know, not good for anybody. And so if we could work more collaboratively, and then, you know, also find maybe a plan that would include insurers, maybe Medicaid or commercial reimbursement or something to, you know, for produce purchases, which might help in the long run. You know, we're working on this from all angles. We have Meals on Wheels for seniors. We're looking at programs for our you know, families, and we're looking at school meals. There's just so many different, you know, facets of this where we need to work collaboratively. So I think the more that we can do that, the better off we'll be in the end, and not be competing, as you mentioned, Mariana, you know.
Okay, Mariana, did you want to add anything?
I feel like they've covered it.
Okay, great. Yeah, okay, great. Thank you so much. I feel like, yeah, a really key kind of thing that I'm taking away is, as you've all said, the importance of collaboration to kind of avoid participating in a competitive funding environment, and, you know, thinking about bulk purchasing and some of the other kind of approaches that you noted to avoid that, or consider, you know, alternative avenues. So yeah, thank you so much. I think we are going to shift now to question and answers with the panelists. As Megan noted, there was a lot of great conversation happening in the chat. So let me just, if you do have a question, oh yeah, you can raise your hand. Let me see, return to the top here. So, sorry, I'm just trying to see where the first question was. Okay, So Julie asked, are there successful models in other states, regions, or countries that we could learn from? I know you'd mentioned the sugar sweetened beverage tax, but any additions?
I mean, I can definitely say that as Meals on Wheels of Rhode Island, in some ways, like we feel we are the national model because we are a statewide program. I know Jeanette talked about this, you know, across the country, you've seen like one Meals on Wheels, you might have seen one microcosm of a home delivered meal program. So, you know, because we are a statewide organization now serving Block Island, if I don't get a chance to like call out our expansion onto Block Island, I don't feel like I did my part. But, you know, like you know, and then we have this emerging strategy, right? Like, how do we grow our model? How do we use this trusted model to serve different types of people, deliver medically tailored meals, and change the product we're bringing to people's doors? So, in May of last year, our board of directors actually flew in the chief strategy officer for Meals on Wheels America. You know, and he sort of said, like, we think we're on to something here that's working. We want to confirm that in the national big picture, like we're ahead of the curve in the way that we think we are. And I think it was like a very productive and resounding yes. So yeah, I mean, like, you know, some days we feel like our infrastructure can be suffocating. Other days we feel like we're the national model, right? So I think it depends on like how much snow is in the forecast. Yeah.
It's a very good question. And well, something I'm thinking is CartWheel started, or the way that kind of like our predecessor to the work that we do now, started as part of an initiative by Amor. So an organization in Rhode Island, in Providence, that's focused on supporting immigrant communities in the city. And I think I don't know, it just brings to my attention the importance of supporting work that might not be like, it might not seem linked right away to food delivery, food sustainability, food access, but it was very important that we met there because we were thinking about any issues that migrants in Rhode Island were experiencing, and then from there started as like a volunteer initiative to deliver food and other items, and then it became its own organization. So I don't know, this might not be like the most practical matter, but it just goes to show how important it is to have networks of support that go beyond just what we see as food access, to not be kind of like too zoomed in on this thing, and more to think about other ways to build community, because it's kind of like where innovative ideas come from, I think.
You know, yesterday some of us were on a call to learn a little bit about a program called the Good Food Purchasing Program. I know this is happening in New York, and I think it was Illinois. You know, there are things going on that as we learn more about, maybe, you know, we can bring them to our state, and to try things in our state on a smaller scale sometimes may not be as complicated as trying it, you know, out in a larger state, but that may be something that, you know, coming down the pipe that we may have access to.
Yeah. Okay. So
I have a question.
Oh, sure. Yep.
There's two things. One about collaboration, which being a Rhode Islander all my life, a lot of the nonprofits closed down because everyone was fighting for the same grants. So I thought, this is just my opinion, that all the food banks and everyone that's doing the same thing have a conference and meet together, because what Meals on Wheels is doing, the next person's not doing. So if you guys all talk and meet in a hub, then I think it'd be more sustainable, because then you won't be going after the same thing, because not all the same nonprofits are doing the same thing. And then again, Meals on Wheels is the face of the delivery, because they've been around for so long. And then my other thing was about the healthy foods. I know a lot of the food banks do not serve healthy foods because a lot of the
Right.
food are canned goods. So
Right.
another thing, being small, we all benefit, like have a conference and bring Whole Foods in,
Right.
bring Urban Green in,
Yeah.
and everybody has to do donations before the end of the year so they can write off taxes. Being a small state, why don't we start like trying to put things like that in place?
Right. Absolutely. Thank you, Kenya. Thank you. So turning to our panelists, do you want to offer any additional feedback or responses based on Kenya's comments?
Really great feedback, Kenya. So thank you for that. I think that there is a lot of collaboration going. I don't want to say going around, but there's a lot of collaboration in the environment. I think you raise a good point of like, what is the umbrella that sits over all of the collaboration that really gets its arms around food access, food delivery, or maybe it's even bigger than that. And I see Eugenia Marks, who I've known for a long time, has a comment in the chat. But my chat seems to be jumping around here. And, she said, there's a lot going on here. So how do we know that people are getting serviced, like even by the right group? Meals on Wheels, we do have volunteers that we rely on, but we also have paid drivers as well. So how do we make sure the right people, and maybe they're getting service and they could be getting that service through their Medicaid LTSS benefit, right? Or maybe they'd be better served by another group. I don't know how we track that back to making sure that resources are going in the right direction so that more people can be served.
Yeah, thank you.
That wasn't my question. That wasn't what I was talking about. I'm talking about sustainability, about everyone meeting together and talking, and then also meeting with other people, Whole Foods and other people like that for healthy reasons. We know about situations. One thing that we all keep sitting at the table is talking about the problem. We all know what the problems are. We got to come up with solutions so that we're sustainable. Just like when people never talk about prevention, it's always a quick fix for vacation instead of talking about, okay, let's talk about prevention so that you get high blood pressure, that you can't get sugar diabetes. So what I'm saying is, we know what the problem is. What is the solution? Because that's all we keep talking about is the problem. We know there's food insecurities. When you're not part of the 1%, there's insecurity. So what I'm saying is, we have a conference and meeting with everybody that talks about the food bank, this, that, at the Marriott, and say, okay, how can we keep this going?
Right.
Because what you're doing is not doing. So I don't want to hear about this one getting this service from this, that, and that. We all know what the problems are. Let's come up with solutions.
Definitely.
We can't keep having these conferences and keep talking about problems. We got to come up with solutions.
Right. Yeah.
But we are starting to discuss, using food as medicine. It's becoming more important, I think, in the medical field in terms of, we in nutrition have known this from the beginning, but now others are finally starting to listen. And I think the more that, we have Brown Medical School, we have all these programs where we're educating physicians and residents, and the more we can talk about prevention and include that in the conversation, I think, there are some people in our state who have already been and have worked on this in the past. And so I think the more that we can include that in the conversation, the more we can work toward the point that Kenya's making in terms of providing healthy foods and not just, foods that aren't promoting good health.
Yeah, thank you.
Kenya's question, and also, it's making me think back at the question from earlier on what role state and government agencies could have in supporting our work. I think a part of the issue, like why we keep talking about problems and not solutions, is because at least I feel like there's always the emergency, like, and we are trying, we have, if the burden of deciding when to focus on, you know, well, we have so much work delivering and like figuring out our day-to-day logistics, we could do that, or we could spend that time and effort, resources in figuring out sustainability and long-term solutions. I think we end up focusing on the former and being like, well, we just have to respond to this. And then one day we'll have time to think about sustainability and like coalitions and all of that. Maybe, and I haven't seen any specific resources for building collaboration that go beyond like, you know, like a one thing meeting, but if there could be like funding allocated specifically for like, you know, supporting us to work on the long-term strategies,
Yeah,
while also supporting us to do the short-term stuff.
right. Thank you. Yeah, I do want to give, I see Vernon, you have your hand raised. So I did want to give you an opportunity to ask your question around coalition building and collaboration if you want to unmute.
Vernon,
Okay.
are you able to unmute? Looks like not.
No, okay. So their question was around just, have you explored coalition building or collaboration? I know we kind of touched on that a little bit earlier in our discussion, but if you want to maybe add anything else, you know, taking in Kenya's comments about kind of solutions oriented approaches, if you felt like those collaborations, you know, led to an improved outcome. Yeah.
I guess I would put a plug in here for the Food Policy Council. You know, we do set our agenda sort of for activities for the year ahead, starting in the spring. And we would definitely, we invite anyone who wants to join and help set that agenda, and especially have a specific work group around an issue to come together and work on that. So that's one opening I'll leave for a coalition building that might be a really good opportunity. And then I think just we'll get to the conversation later about maybe some immediate actions that folks in this group might want to take in the coming months too.
Yeah, and I want to say also, we've been talking about, you know, how to have more collaboration happen, more coalitions. But I will say, I feel like there's almost nothing that we've done at CartWheel without the support of other organizations. The Food Policy Council, even we did work with Urban Greens at some point for a pilot program. We have the support of Integra now. So there's definitely a lot of collaboration already happening. And about, you know, building off the work that we've done at CartWheel for accepting SNAP funds, I'll have to get back to you on that. But I think, because the person who set up the SNAP platform on our website and who worked with USDA to get that approved and all of that was Evan, my coworker. And I think that this one is a difficult issue because it's by organization. So it's not that we can very easily just get other organizations to like do the same thing, and just like the role that we can maybe play in this is to show it was a very long process, like a whole year long bureaucratic stuff that Evan had to go through to get this set up. So maybe providing, you know, kind of like showing the path to other organizations. But I think it's kind of set up so that it's not all that easy to just, oh, well, this is done by us, now other organizations can do it. I think it's also lengthy for anyone else who wants to try it. But we're definitely open to talking to whoever wants to about setting this up for their own organizations. I think that would be very, very good.
Yeah, thank you. Okay, great. Julie, I see you have your hand raised. If you want to unmute and ask your question.
Yeah, I wanted to say thank you, Kenya, for really focusing on solutions, and I really appreciate the conversation around coalition building, and of course, like the Food Policy Council does so much of that. And there are some things happening that I want to make sure everyone here is aware of, which is an effort towards healthy school meals for all, right? So there's what's coming up for me, and I'm curious how the panelists think about this, but there's these systemic underlying issues of why people need food in the first place, right? Like what Mariana is saying, and we need to address that. And there are big national and global and corporate mechanisms that are causing those issues, right? But we can chip away at some things, and one, of course, it's not the only or the best solution, is the role of institutions. So I know that's something from those of us working, within the state agencies and with many of you on the call, is thinking about the role of institutions. That could be hospitals, that could be schools, that could be colleges, universities, right? And that's tens of thousands, hundreds of thousands of people, right, that we could influence. It may not be 3 meals a day, but it might be 1 meal a day. And I know there's good work happening there. And I just want to elevate that the Food Policy Council has a working group and is working with partners at the Healthy Schools, Karen Weatherall's.
Yeah, there's the Healthy Schools Coalition, and there's also a statewide Healthy School Meals for All Coalition that is working on the legislative effort around that.
Right.
Yes.
So, and that of course happens outside of state agencies. That happens with public and voters and that mechanism. So, so that's happening now. That's one angle that I just want to make sure that this group's aware of, and perhaps we could do a better job of making sure, like at HETF, whoever is new attends, understands that. And I think there's also a successful coalition, Nourish RI, right? I don't know if Carrie Connolly's on the call, the Rhode Island Food Policy Council, along with the Rhode Island Food Bank and many others, successfully led like a 2-year legislative push for the SNAP incentive, which has become the Eat Well, Be Well program, now administered by DHS, right? These are not gonna like shift the whole boat in a different direction, but they're helping us to turn. And so I think I just want to elevate those as successful models, or hopefully successful models that folks that join this call can put more effort towards. And then to Mariana's point about emergency, I think that's so spot on, right? It's so hard when you're focusing on the fire to figure out like how to fireproof the whole house, right? For you need to think more like what Kenya's saying about sustainability. So I think we need to figure out ways to hold both. And maybe there are efforts happening across this front, and maybe we need to figure out how to communicate that better, right? So we can all work in the same direction, as opposed to fighting for similar amounts of funding, like you were saying, Mariana.
And if I may speak to another coalition effort, I think there are a number of people in this meeting right now who have been working with the Food Policy Council on our produce prescription, what do I call it? Analysis planning. So there are 5 different programs throughout the state that do delivery of produce of prescribed fruits and vegetables to make sure that people with diet-related medical issues are having access to the fruits and vegetables they need for their diets. And so we've been working with those 5 different programs to look at what the challenges are in the way models are currently operating, and to come up with some solutions around if we were to do a collaborative statewide model to handle some of the things like the logistics of delivery, the logistics of bulk purchasing, the logistics of those other things that really are challenges to those individual efforts, looking at how we can come together and do a structure that benefits everybody, so that programs can both be operating in the individual way they need to meet their specific clients' needs, because everyone has different clients and different profiles, but also can benefit from some real shared coordination. So we're working together with those cohorts. We're actually having a meeting coming up at the end of February to have a lot of folks get our heads together about figuring out next steps on moving forward for that. So hopefully in the not too near future, there'll be some, real steps moving forward to coordinate together around that.
Yeah.
Yeah.
Thank you, Rachel.
something else that is a totally different subject or different direction that I think Mariana mentioned was, I think a lot of times about how this fits into our big state infrastructure, period. And I think, one of the things things that Mariana touched on was part of the challenge of getting food to people is actually that people can't get to the food, that we don't have a robust enough public transportation system, for example, to meet the needs of a lot of people. And so we end up using, I think sometimes food delivery ends up coming in because we have a lack of other infrastructure built out so that people can do the things they need to do to connect themselves with food. So I guess just the thought. I'm wondering if any of the panelists have thoughts on sort of those broader state transportation and infrastructure and policy issues and how that impacts your work.
So
I
are
think
you asking, I'm sorry,
yeah, well,
Rachel, are you?
asking the panelists, those of you who kind of have to deal with the logistics of actually getting food around to people, right? What are the bigger sort of policy and planning and statewide issues around that impact you? I think even, we all talk about the Washington Bridge at this point, is that situation impacting your ability to serve your clients, for example?
Well, at this point, for our program, we, unlike, Meg, where you're delivering year round, we're delivering only during the summer months. So we haven't had to deal with the bridge yet. I don't know. I'm hearing now it's going to be years to fix that problem. So I think we're all going to be experiencing it on some level. However, transportation was really a big issue. The first year we did this, we were having people pick up. And we were doing some home delivery for those people who couldn't get there, get to the pickup points and whatnot. And it was like an all hands on deck. If it was delivery day, we would take bags in our cars and go on the way home from work or, during the day or whatever, because we really thought more people were going to be able to pick up, and it didn't work out that way. So transportation became a huge issue. And then this past year, we did a little bit differently where we did all delivery, but we had locations at the clinics where they visit, so that it was more local to them. But I think transportation is always an issue. And then, of course, the first year we were bagging the produce. We would get it in bulk, and then we would set up kind of like a line, and everybody would do their thing and put in 5 apples and 6 of whatever. And then this year, it was very helpful that Southside Community Land Trust, we provided the bags and they bagged it for us. And that was a huge help. So, there's all these logistics that have to be worked out, and we're still growing, and, we have a lot of growing pains. So I don't know, I'm sure some of you have even better and more successful ways and have been doing this longer.
So Meals on Wheels, we've delivered 20 million home delivered meals since our inception in 1969. I mentioned we are statewide and we service Block Island, but one of the goals in our 2025 strategic plan looks at our model to ensure it's high performing. Again, like we have our older adult program, which is part paid delivery, part volunteers. And so how do we ensure the continuity of someone that might be on a paid driver route where they see their driver 5 days a week, or someone that's on a volunteer route, which maybe isn't in an urban core, right? And might see 5 different volunteers throughout the week. So that's kind of like a way that like even inside our ecosystem, our delivery is different. We have a fleet of vehicles. I think we have 18 cars at this point. So now like thinking about climate goals in that like we are a gas powered model, right? And we drive a lot of miles, and how we can think bigger about climate and our impact. When you think about how we package and deliver our meals, like we're very high like plastic consumption model, right? So again, like thinking about that. But then I think about like all of the inputs that then go into our output. Insurance, right? That covers people driving on the road, that covers people seeing people in their homes, the background checks, the technology that we leverage to run our routes, the catering relationship, the high-tech cook chill model that goes into our prepared meals. I mean, I think that there could definitely be some peer sharing around kind of like what we do, how we mitigate our risk, right? And how we're thinking about our model into the future, and kind of all get our heads together on that.
Yeah, maybe also, well, first, shout out to community gardens. I feel like that's just a huge, very important resource that I see. There's the Western Community Center is also thinking about this kind of issues. I feel like it's one of the pantries that I see trying to do more innovative work. And some of the insights from that pilot that I mentioned earlier through the Food Policy Council, I had the opportunity during that pilot program to have more extended conversations with clients, and it was really illuminating for me to find out that many of the clients that we were serving were actually like really wanted to go out and get their own groceries and their own food. And if they had had a bus stop a little closer to their home, they would have done it themselves. There was this one man who told me like, yeah, I would rather like go to the supermarket several times a week and get a couple apples myself. Like I cannot carry a lot of stuff, but I will gladly do it because then I get to see people and I like get some fresh air. So there is, I think, a very important point to be made for better public transportation. And yeah, other than that, I think we also, we do run into the problem of economies of scale with our delivery driver. Right now, there's one person at CartWheel who does all the deliveries for the food pantry. And if we didn't have the scale, like before we reached the point where we're at right now, where we can have deliveries 5 days a week, thanks to our work with Integra and our work with the pantries, then we couldn't have one person do that. And it becomes a matter of like, oh, where can we have like maybe like 3 different people who are doing deliveries, but we cannot expect them to be available and willing to do it if it's just like a 1 day a week kind of gig. So the more that we can, like the more deliveries we do, the more sustainable it is in every way.
Yeah. Thank you so much. So we are at time on our.
Sarah, it looks like Denise Green has her hand up.
Oh, do we have time for one more question?
I just was going to jump in and mention the bus going by the person's house is only one of the challenges. I run one of the busiest food pantries in the city of Providence, and RIPTA doesn't go by the food pantry.
Right. Yeah.
So, yeah, I mean, I think that is a huge problem in the system,
right,
when the bus routes aren't even going by the agencies designed to be supporting the most vulnerable of our people.
Yeah, that is a great point. Thank you for sharing. Yeah, absolutely. Okay. Well, thank you so much to our panelists and to those of you who joined us today for sharing your questions and offering your comments and really helping to kind of fortify our conversation. I'm going to pass it now to Rachel. Thank you.
Thank you again to the panelists. That was great. And also some really great questions, and definitely can tell that a lot of folks are passionate about this, want to make something happen. And then also, I think have a lot of good insights about the broader efforts that this needs to connect into. So thank you all for that very much. As I mentioned at the beginning of the meeting, this year we're moving into a different model. We were really looking for, I think the HETF meetings in the past have been a really great information sharing source, but we wanted to offer an opportunity for action to people to come out of these meetings and, really have an opportunity for change. So a new structure that we are introducing this year for the HETF is what we're calling action groups. And the way that that's going to work is that each quarter we're going to have a subject that we are going to ask who's passionate about this, who wants to work on this, and we're going to ask for volunteers to meet 3 times between each quarterly meeting to develop a series of recommendations for state agencies around whatever the topic is. In this case, we happen to have our topic of our panels lines up really nicely with what our action group is going to be. That isn't necessarily going to be the case for every quarter, but in this case, we know that people have a lot of really great thoughts, and we think that there might be some real recommendations for state agencies that would bring about some of the change that you all are looking for. So what we're asking for is 5 people, at least 5, a minimum of 5 people to join this action group over the next 3 months. They will meet for 3 one-hour meetings. And during those meetings, the Food Policy Council staff, Max and I, will facilitate the conversation. And by the end of the 3rd meeting, we will work to come to consensus on some recommendations that will be delivered at the IFNPAC meeting, the next IFNPAC meeting. So that the IFNPAC meeting is a place where different state agencies convene to talk about all issues of food access and food security. So I wanted to open this up to folks. First off, just to let you know that the topics that we have agreed on for the 4 meetings were offered as a poll at the last meeting of 2023, and then also emailed out to everyone who's on this HETF email list to ask for what your preferences are. So as I mentioned, this very first one will be on this issue of food delivery, but the upcoming meetings will be on different topics. The course of the 3 meetings between now and the next HETF meeting will be this. At the very first meeting, we will work together to kind of define the problem and identify the state agencies that we want to direct the recommendations to. I think, as was mentioned earlier, a lot of times, Kenya mentioned, a lot of times people get very comfortable talking about the problems, but we want to make sure that this is, that not we just identify a problem, but identify the agency or the individual that we need to ask to take action at the state. So that'll be sort of our very first meeting together. And then the second meeting will work together to draft these recommendations and come to consensus on what they should be, and we'll finalize them by the 3rd meeting. And then that action group that has convened will come together. They'll be invited to the IFNPAC meeting to present the recommendations to the state agencies. So we're going to put the action group registration link in the chat. Anyone who's interested in joining this action group, let's see. Max, are you able to drop that in the chat, or Allie? So once that comes up in the chat, if you're interested in joining this action group over the next few months, please click on that and register yourself. And then we'll be reaching out with some scheduling emails, et cetera, to pick the dates for the next couple of meetings. I think, yeah, so I just want to thank you all for your interest and commitment to this. I think that there is some really good thinking that will come out of this. And I think I have just maybe a minute if there are any questions about this process. Seeing none, I don't see any hands. Thanks so much. There's the link that's up there. So please, if you're interested in 2 or 3 meetings between now and March, please click on that. Oh, Max, I'm wrong. In March and May, between now and May. Yeah. Thank you. It's already February, isn't it? God. 2 or 3 meetings between now and May. Please register via that form. Okay. given that, I'm really excited for what comes out of that. And if this isn't the topic that you're fired up about, there will be more topics coming up after the upcoming HETF meetings that we would love to ask you to join in on those ones. Next, I'm going to turn it over to Julie Stelmazik, who is going to give us an update on the development of the 2030 food strategy. Julie?
Thank you, Rachel. Hi, everyone. Hi again. I just want to give a brief update on this statewide planning effort. But first, I know that there's constantly new people joining the HETF, so I'm curious. I think I can see most of you or your name. Can you just raise your hand or give a thumbs up if this is your first HETF meeting? Lindsay and Sarah, Eugenia, Ray, good. Thank you. Kenya, hi. Thanks for joining. It's good to know instead of just assuming that everyone's been in the loop with these. And thanks for making the time, everyone, for being here. So for those newcomers, you would not have heard me say this at the I think 2 meetings ago, that we are in the midst of updating our state's food strategy. We're one of 18 states that has a state food plan. It came out in 2017, and it was always meant to be a 5-year plan. And it really brings together efforts across not just food security, but workforce development, economic development, environment, and resilience around our entire food system, from production to disposal. So we're working on this effort with partners within state agencies, the Division of Agriculture, Commerce, Department of Health, and many others. We're partnering closely with the Rhode Island Food Policy Council, the Narragansett Indian Tribe, and folks like yourselves in this process. So what we've been doing is kind of these 3 phases of understanding, planning, and co-creating. We're currently in that understanding phase, and we'll plan to have this complete by the end of the year. And it's meant to be a collective impact effort towards 2030. So this is kind of our 2.0. You could think of Relish Rhody as 1.0, and this is our 2.0. And just to give an example of kind of why these things matter, this Hunger Elimination Task Force was actually a strategy that came out of Relish Rhody back in 2017. So this is an example of that kind of coalition building efforts that can be supported through more statewide planning and strategic initiatives. So I just want to make sure everyone's aware of that and give the update that we're still in this kind of learning phase. We'll be engaging a broader group of stakeholders over the summer with an in-person strategy summit. And then we're planning to have sort of town halls, listening sessions, public comment happening throughout the fall. And it will only matter that this is a living document that works and directs resources and initiatives and funding if it is relevant to the people it's meant to serve. So the question that I have for all of you, if you could kindly just put this in the chat, is who or what organizations should know about this? Who might want to be engaged? At a minimum, just informed and aware of it. At a maximum, maybe involved in some focus groups or joining an advisory board and those kind of things. One example of way, and then kind of a follow-up, are there any events or activities that you know of within the spaces that you work in between now and the fall that we should be aware of and try to connect with? And I'll just give some examples of that. Rachel and I are going to be participating in the HES learning community. So the health equity zones that are run through RIDO, they meet 4 times a year as a group. And so we have the opportunity to kind of share these planning efforts. Rachel, of course, is leading a food preparedness and recovery plan that will work in parallel and concurrently with this longer term food strategy. So if you could, please put in the chat so we can capture. You don't need to put emails in. We can follow up with you about that, but just kind of maybe you yourself are interested in knowing about this or providing more input into what it should look like and what those strategies and priorities should be for 2030. Or maybe there's some events that you know of that we should show up at and try to engage with that audience. So that's all I'll say. And you can always reach out to me as well. I'll make sure that I put my name in the chat. And we also have a newsletter that you can join just to kind of stay in the loop about this effort. So thank you.
Thank you, Julie. Yeah, and I have an update to share. So Julie mentioned the preparedness and recovery planning process. So I think a lot of you who are in this room have heard maybe me speak of this before, and if not, I'll give you a very quick rundown. Essentially, you know, I don't know, we're not out of the COVID crisis yet, but having come to where we are in the COVID pandemic, folks really recognize that we have a need to develop a statewide plan and strategy for food emergency preparedness and recovery, so that we are in a better place than we were in March 2020 in terms of knowing how to meet emergency food needs, and also are in general more prepared and resilient for our communities are more prepared and resilient to in general to food emergencies. So we know that the priority in that planning process has to be communities that are most vulnerable. So that will be really what the focus is, folks who are most susceptible to and most heavily impacted when there is a food emergency of some sort. And we are undertaking a planning process to develop this. The outcomes of the planning process will be recommendations to state agencies and major partners. We have recently engaged Spartina Consulting, who is going to be coordinating the planning process for us. There's going to be a whole series of interviews and focus groups and some public events to really work on getting all the information that they need to work with state agencies and develop a plan, both an immediate response plan, an emergency happens, who kicks into gear, whose job is what, and then also sort of some larger structural issues around our food system. This document that we'll be creating is going to be a parallel accompaniment to the larger statewide food system plan that Julie was just speaking about, but obviously there'll be a lot of interrelations between the two. Many of you will hear more about this process at Moves Forward. You will probably be asked to be in focus groups or maybe key informants and key interviews to help make sure that we're getting all the information that we need to put together a great plan. And as Julie said, one of our early activities actually is going to be at the upcoming HES Learning Community. We're both going to be giving the communities there an update about this planning process, but then are also hoping to use as an opportunity to have a focused conversation with people representing those HES communities about their need for emergency food response, about their systems of communication with the state and things like that. So the other thing that we're going to do is at upcoming HETF meetings, we're always going to be giving throughout the year updates on this process as it moves forward. We're also going to be using some of these meetings, the next upcoming one in the spring in particular, as a way to have a really focused conversations with those of you who come into this space about your perspectives and needs around emergency food response. So we'll definitely, if you're regular attendees here, we will speak to you about that again in May. And if you're not a regular attendee, I definitely invite you to come back to the next meeting in May so that you can be involved in that conversation. So that's the update on that. We also have an update and announcement about Roadie Feeding Roadie Alliance that Nessa is going to cover. Nessa, are you with us?
Yes, I am. Been really interested in the conversation and so excited to see this first work group get together. And just wanted to say a couple things about a meeting coming up of the Roadie Feeding Roadie Alliance. This is an alliance that the council has helped to start in partnership with some amazing organizations that are bringing local food to local food insecure communities, and who want to create sustainable connections for local farmers and fishers with food pantries and food rescue organizations and food distributors and other partners, so that Rhode Islanders have consistent access to fresh, local, culturally appropriate food So this is really a connection making opportunity to come to the Alliance to, if you are a farmer or a fisher who's interested in potentially selling in to this market, or if you are an entity that provides emergency food that wants to explore having more local food or local food at all, if that's not something that you do, whether you provide meals, prepared meals, or raw products, fresh or preserved in some way, and whether you are small or large. So this is really about ensuring that our local emergency feeding system can serve as a reliable wholesale market for our local producers and harvesters, while also becoming more resilient to supply chain shocks that can occur, as we all know, from public health emergencies and other climate-related challenges. And we are having the first Alliance meeting, which they're going to happen quarterly this year, on Monday, February 12th. So it's coming right up. It's at noon, so you can join during your lunch break. And on the agenda, you can hear some success stories related to how this work is going so far. Importantly, you can learn how to get involved, and you can connect with local food sellers if you're a buyer, and buyers if you are a seller. So Allison has put, I think it was Allison, has put the link to the Rhody Feeding Rhody website into the chat, and also the registration information. Please join us. I think you'll find it really interesting to learn about what's going on in the field, and more importantly, learn about how you can take action from wherever you sit to build this market for our local farmers and fishers, this market that serves our food insecure communities. So that's my quick announcement, and I'll pass it back over, I think, to Rachel.
Yeah, thank you. Thanks so much, Nessa. That sounds like really exciting, and I think is the kind of coalition building that folks in this meeting were talking about. So I hope you all are able to join if that's something that you want to get involved with. So I want to open it up we have a few minutes for folks to share other announcements. You're welcome to put them in the chat or to raise your hand if you have other things you want to share with the group. Before I start reading any of those, I do want to just take a minute to thank Max DeFaria and Allison Montagnon for their tech support in this. You've both been great. Allie's been very silently behind the scenes running everything, so it's been fantastic. Thank you both so much. Do folks have announcements that they'd like to share with the group? I don't see any. Okay. Wonderful. In that case, I'll head it back to you, Max, to close, please.
Thanks, Rachel, and thank you everyone for joining today's meeting. So I wanted to start off with letting you all know we will be resharing the action group registration link immediately after this meeting. So at 3:30, you should all expect an email in your inbox with that link if you didn't get a chance to register with it in the chat. Please feel free to share that form with other folks in your network who would benefit or would enable us to do a better job in developing these recommendations. So please do not hesitate to share the link around with others to develop these recommendations for state agencies. We also wanted to remind you all that our next quarterly meeting, quarter 2, will be on May 7th at 2 p.m. At that time, we'll be seeking the group's feedback on the creation of the state's first ever food system and preparedness and recovery plan that Rachel was just sharing about. So if you're really interested in talking about how we can prepare for another COVID-like situation, definitely bookmark May 7th at 2 p.m. in your calendars. That session will be jam-packed with a lot of great time to chat and share your feedback. And with all of that, once again, we want to say thank you for joining us, and we will see you at our quarter 2 meeting. Thank you all.
Thank you all. See you soon. Take care.